Hello and welcome to the first in our latest series of videos looking at our new regulatory approach. Today we're focusing on our new single assessment framework. So why do we need to change? Here are 3 big reasons. We need to make things simpler. Our 4 assessment frameworks are long and hard to follow. They're applied inconsistently and there are huge amounts of duplication within and across key questions. The areas we look at are poorly defined and as a result we find it hard to focus on what really matters. Secondly, we need to better reflect how care is actually delivered. Care is increasingly integrated and delivered in joined up ways, and our assessment framework needs to provide the basis for looking at different service types across a local area and not just along sector boundaries. Thirdly, we need to better join up registration to our other work. There's currently a disconnect between what we look at when a service registers with us and when we carry out regular assessments of quality, and using separate frameworks only compounds this problem. What are we doing about it? Our assessment framework is built on our 5 key questions and well-known rating system, and is what we'll use to set out our view of quality and make judgments. We'll use this to assess quality in all service types and at all levels, as well as for local authorities and integrated care systems. It will act as a golden thread that we'll use consistently when first registering at the level of good through to ongoing assessments of quality. And this will replace the current 4 separate frameworks for registering and assessing healthcare and adult social care services. We've already confirmed that our ratings and 5 key questions will stay central to our approach, but we're replacing our existing queries and prompts with quality statements and evidence categories. These will reduce the duplication that's in our current frameworks and will allow us to focus on topic areas under each key question. We call the quality statements we statements, as they're effectively commitments and they're written from a provider's perspective or a system's perspective to help them understand what we expect of them. To make our judgments more structured and consistent, we've developed a way to categorise and score evidence. The 6 categories of evidence are people's experience, feedback from staff and leaders, observations of care, feedback from partners, policies, processes and procedures, and outcomes. We want to be clear with providers and the public about how we use the information we have about care in a service or a local area. So we will set out which of these evidence categories we'll always want to gather evidence against in order to make an assessment. We'll do this for each service type and at each level, including at registration. Our operational colleagues will gather evidence specific to their area of expertise in order to make a judgment. By structuring our assessment framework in this way, we can ensure that our assessment framework has the flexibility that we need. In many ways, this will all be data and evidence already familiar to providers and to our inspectors. By bringing in the 6 categories and setting what we always need to collect and review in order to make a decision, alongside a way of scoring our evidence, we are able to bring a much more structured and consistent approach to assessing quality. What does this look like in practice? As we've said, we're moving away from 4 frameworks down to 1, getting rid of our queries and prompts and creating a set of quality statements in their place to help providers be clear about what we expect. Let's have a look at some examples. Under SAFE, there's a quality statement for the topic Safe Systems, Pathways and Transitions. You can now see that on the screen. We work in partnership with others to establish and maintain safe systems of care in which people's safety is managed, monitored and assured, especially when they move between different services. The majority of our quality statements will have a relatively clear link back to our old queries and prompts, but in some areas we've added emphasis. For example, here we've made a stronger connection to our strategic aims around safety cultures and learning. We have a proactive and positive culture of safety based on openness and honesty, in which concerns about safety are listened to. Safety events are investigated and reported thoroughly, and lessons are learned to continually identify and embed good practice. We've also introduced new topic areas based on their increasing significance in healthcare and in wider society. For example, under environmental sustainability, we understand any negative impact of our activities on the environment, and we strive to make a positive contribution to reducing it and supporting people to do the same. So these are just some of the changes we're making. I hope you've enjoyed this quick run through of our new assessment framework. Please join our next one on how we're creating a seamless registration service.